Globally, stroke is one of the leading causes of death and disability in women. In 2019, around 3 million women died from stroke. Women have reportedly lost a total of 10 million years of healthy life due to disability following a stroke. Now, all these figures and facts, does this apply to pregnant ladies? Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about how pregnancy loss is related to more prevalence of stroke in women. Infertility and pregnancy loss are associated with an increased risk of non-fatal and fatal stroke in the later life. This is in accordance to an analysis of observational studies that was recently published in the BMJ journal. Early monitoring of women who have experienced miscarriage or stillbirth along with healthy lifestyle changes could lower the risk of stroke. The questionnaires were used to find information on infertility, miscarriage and even stillbirth. Hospital data were used to identify the cases of fatal stroke and subtypes of stroke. Overall, over 6 lakh women were included in the study, and the study results highlighted that among these women, 2.8% experienced a first non-fatal stroke at a median age of 62 and only 0.7% had a fatal stroke at a median age of 71. Now, women with a history of infertility were at a 14% higher risk of non-fatal stroke than women without infertility, while miscarriage was associated with 11% higher risk of non-fatal stroke compared to those who never had a miscarriage. Also, for women who had 3 or more miscarriages, the increased risk of non-fatal ischemic and hemorrhagic stroke was 37% and 41% respectively. Similarly, for fatal ischemic and hemorrhagic stroke, 3 or more miscarriages were linked to 83% and 84% risk increase. The researchers therefore concluded that the link between infertility and increased stroke risk may be due to conditions such as polycystic ovary syndrome, which is the PCOS condition that is commonly happening, and premature ovarian insufficiency, while endothelial dysfunction, which is usually the narrowing of the heart's blood vessels, may explain the increased risk of stroke for women with a history of recurrent stillbirth or miscarriage. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.